My name is Brian Hathaway.
I'm Brandon Hathaway.
We're going to talk a little bit today about sleeping and back pain.
A lot of times when people come into the clinic, they often complain of having increased back pain when they're sleeping or in the morning, which you typically wouldn't quite expect because you're not walking around. There's not an increased load on the spine. You're laying down. So a lot of times people are confused as to why that happens.
So we're going to try and explain that a little bit. There are many diagnoses, for back pain, and some problems can cause symptoms down your leg. We're going to try to very quickly go through them and ways to sleep to try and help them. There's a couple things that happen when you're sleeping at night. Number one, you're not moving. And when you're not moving, inflammation can accumulate and it can start to wake up those nerve fibers that tell you that you're in pain. When you're up and about, moving around, your heart rate's up, your blood pressure's up, you're moving, you have a washout effect. So sometimes when you're stationary, it's not always the best thing. And then there's one other thing that happens when you sleep at night, and that is that the discs in your spine expand with a little bit more fluid. So there's more pressure in the disc wall. So think of this: if you have a tire inner tube with a weak spot and you put more air into that tire inner tube is going to lip out. And so that can cause problems as well. So we're going to show a couple positions that you can use to fight back against with sleeping. Obviously, these are things for you to try. If you have not had your back and or leg symptoms checked out, you should get to a doctor and have them checked out. So we're going to talk about, first of all, if you have increase in pain, if you're standing or walking, we're going to show you the mechanics you would want to do lying down to help that. So Brandon's going to lie down on his back. Typically, we will see that people are better when they're sitting. This is the position we want them to sleep in. We can prop his legs up. This helps to flatten his back a little bit, which is something that we see in sitting. So as we age gracefully, sometimes we get a diagnosis that's called stenosis, which is narrowing in the spine. This position helps to open that up. Now, the other thing that we can see is sitting, bending can increase my back pain. It can send pain down my leg. So this typically not a position that we would recommend. What we would recommend is actually the opposite, where Brandon is going to roll over onto his stomach. And now he's kind of facilitating a position as if he was standing or walking. I don't like this position here. I typically like my patients to slide off the edge of their bed. It takes a little bit more of the stress off of their back. We can see he's got a curve here. Now, sometimes this can be uncomfortable. And if you're struggling on your back, on your side, on your stomach, here's something you can do right away to try and change that pressure. We can put a pillow right underneath the stomach. And as we can see now, this curve has reduced. Sometimes in the clinic, I will stack 4 pillows underneath somebody's stomach. And every couple minutes, we start to pull them out as they are able to go down further into what's called lumbar extension, which seems to help some of their symptoms. So this is the 2 simple positions to do in regards to taking care of your back, either laying on your back or laying on your stomach, noticing that you can change the position of your spine by putting some pillows underneath your stomach. What we're going to do next is we're going to talk about what to do when you're laying on your side.
Okay, so now we're going to look at the side lying position. Depending on your stiffness of your bed or the amount of pillows you use can affect the alignment of the spine. So we'll take a look at Brian's spine here real quick. You can see that in his low back, it looks pretty straight, but as we get to kind of where his rib cage starts here, we get a curve bending down and then up, okay? So there's a couple things we can do to fix that. Very simple. You can take either what's called a lumbar roll, or you can just fold up a pillow and put it underneath your low back here, okay? So we'll put that under his low back. And you can see all of a sudden, low back is still straight, and this curve here, okay, it's decreased. There's still a little bit of a curve, so we might want to fold this up even more to straighten that out nice and perfectly, okay? If you have symptoms related to a disc that is going down your leg, you want to start with the affected side, so your involved side, down on the table. If that doesn't work, you can try laying on your other side, but this is just a really quick way to align the spine when you're in side lying.
So those are a few tricks that we can do to fight back against back pain that happens during the night or is worse first thing in the morning.
The first thing you should always try, probably the simplest thing you can do, is just try sleeping on a different surface. You know, if you're sleeping in your bed and it's not working, try sleeping on the couch, try sleeping in someone else's bed. Just find a different surface. A lot of times that can do the trick.
And remember, there are mechanical changes that occur during the night. There is more pressure that starts to build in your spine. And typically for those of us that don't have back problems, we don't notice that. But you want to use these positions, whether it's laying on your back with a pillow under your knees, laying on your stomach with 1 or 2 pillows under your stomach, or even in the side lying position. Brandon showed you what my spine looks like. And let me tell you what, everybody's mechanics are a little bit different. In fact, a lot of times males, their shoulder width is different than their hip width, and vice versa for females. Sometimes their shoulder width is narrower than their hip width. So when they lay on their side, they are more side bent than I may have appeared. So you can roll that pillow up. There is another option. You can actually purchase a roll where you put it around your waist and you tie it on. So whether you roll on your side or on your back, you have support. I'm not necessarily a big fan of it being on your back when you're laying on your back. I don't like forcing our back into that arched position because sometimes that can increase our symptoms down our leg. Even if we see in physical therapy that it's a direction we need to go, sometimes it's not conducive to take it too far too fast. So that's our tip for the day. Hope you have a great one.